Imagine a world plagued by coughs, chronic pain, and the growing specter of morphine addiction. Then, a dazzling promise emerges. A new, non-addictive miracle drug. It was hailed as humanity's savior. The late 1800s were brutal. Diseases like tuberculosis brought coughing fits, and widespread pain often led to morphine, itself highly addictive. Doctors desperately sought new, safer solutions. In 1897, at Bayer, chemist Felix Hoffmann created diacetylmorphine, a modified form of morphine. The company, seeking a grand name, called it heroin, from heroic, believing it was a monumental achievement. Bayer launched heroin with aggressive marketing. Advertisements promised relief for coughs, bronchitis, and tuberculosis, claiming it was safe, effective, and crucially, less habit-forming than morphine. A true medical marvel. Doctors, eager for effective treatments, began prescribing heroin widely. From hospitals to home remedies, it quickly became a household name, an accessible solution for all manner of ailments, from coughs to pain. But the miracle was short-lived. Patients who had found relief began experiencing unsettling symptoms when their doses ran out. An intense craving, annoying dependency, far stronger than with morphine, was emerging. Doctors slowly recognized the horrifying truth. Heroin was not a cure for morphine addiction, but a more potent, faster-acting, and insidious addiction itself. Their miracle had become a nightmare. As the truth emerged, a tragic wave of addiction swept across America. What began as a medical solution transformed into a hidden epidemic, affecting people from all walks of life, often in plain sight. Public perception rapidly shifted. Once a trusted remedy, heroin became synonymous with moral decay and urban squalor. The miracle was now a menace, fueling a moral panic and calls for action. In 1914, the U.S. Congress passed the Harrison Narcotics Tax Act, controlling and taxing the production, import, and distribution of opiates and coca products. Heroin's era as a legal medicine was over. Criminalization didn't erase addiction. It merely drove it underground. A burgeoning black market for heroin emerged, fueling organized crime and creating a new dangerous landscape for users and society alike. The public now saw drug users not as patients, but as junkies, moral failures, criminals. This brutal stigmatization pushed addiction further into the shadows, making recovery even more difficult. A century later, the echoes of heroin's story resonate powerfully. New miracle drugs, like OxyContin, were once again hailed as non-addictive, only to unleash another devastating opioid crisis upon America. Heroin's journey is a stark reminder of scientific hubris and unintended consequences. The fervent hope for a medical miracle can blind us to the potential for unforeseen disaster, leaving generations scarred. The story of heroin is a powerful cautionary tale. It teaches us vigilance, critical thinking, and the profound responsibility that comes with scientific innovation. A lesson humanity continues to learn, sometimes at great cost. But as millions embraced the drug, a disquieting pattern began to emerge. Faint whispers of dependence, then louder cries. Doctors, who once championed the drug, started reporting unusual patient behaviors. A reliance, an inability to function without it. Initially, these were dismissed as isolated incidents, perhaps misuse by a few, not inherent flaws in the miracle cure itself. I felt a growing unease. My conscience demanded more. We had to understand these new patient reports. Science demanded answers. Her research began to uncover a disturbing truth. The drug didn't just alleviate pain. It altered brain chemistry, creating a physical dependence. We had created a generation reliant on something we thought was a cure. The promise had become a prison. My heart sank. Armed with irrefutable evidence, Dr. Reed confronted the pharmaceutical giants, demanding a recall, a warning. But profit often deafens truth. Meanwhile, across America, Patients who had trusted their doctors and the promise of relief found themselves trapped, suffering withdrawal, their lives unraveling. Journalists began picking up the story. Local papers published heart-wrenching accounts. The miracle drug was starting to gain a new, darker reputation. Families of the addicted organized, demanding accountability. The public's trust in medicine, once absolute, began to crumble. Every success had been fueled by a terrible ignorance. How could we, driven by the best intentions, have caused so much unintended suffering? The repercussions were immense. Reputations shattered, careers ended. But far greater was the human toll. Lives derailed, families broken by the insidious grip of addiction. The era of unchecked medical optimism ended. My life and the course of pharmaceutical research forever changed by this painful lesson. The legacy of this drug forever etched into history. A stark reminder of the unintended consequences when innovation outpaces ethical diligence and thorough testing. This tragedy sparked crucial reforms in drug regulation, forever changing how medicines are developed and approved. A painful but necessary evolution. In the mid-1990s, a new miracle drug promised to revolutionize pain management. OxyContin, hailed as a breakthrough, was aggressively marketed, changing medicine forever. Purdue Pharma assured doctors OxyContin was safe, with a low risk of addiction due to its slow-release formula. Sales representatives fanned out, promoting its widespread use for chronic pain. Pain, once considered a symptom, was now treated as a fifth vital sign. This shift in medical philosophy paved the way for more aggressive opioid prescribing, often with good intentions. The focus shifted from short-term relief to long-term pain management. Doctors, pressured by new guidelines, began prescribing opioids for conditions that previously wouldn't warrant them. The promises were enticing: sustained pain relief, improved quality of life. For millions suffering from chronic pain, OxyContin seemed like a true answer to their prayers. Across America, prescriptions for OxyContin soared. This widespread adoption, driven by marketing and evolving medical practice, laid the groundwork for a public health crisis. Yet, early warning signs emerged. Some patients, finding the slow-release mechanism insufficient, crushed the pills for an intense, immediate high, quickly spiraling into addiction. Doctors, initially trusting Purdue's claims, began to notice patterns of dependency and requests for refills escalating. A subtle unease began to creep into their practices. Despite mounting evidence of addiction, Purdue Pharma maintained its stance. The drug was safe and addiction was rare. They even blamed patients for misusing the medication. For many patients, relief turned to dependence. The physical agony of withdrawal became a cruel trap, forcing them to seek more of the drug just to function. The cycle of tolerance and escalating doses became common. Patients found themselves trapped between chronic pain and an insidious, growing addiction, often bewildered and desperate. The prescription pad became a gateway, not just to pain relief, but to a deeper, more destructive dependency. Communities soon felt the ripple effects of this growing crisis. As the opioid crisis deepened, it could no longer be ignored. Local news stories began to report on overdoses and the devastating impact on families and communities. Families sued, states investigated. The narrative of a miracle drug began to unravel, replaced by the grim reality of widespread addiction and death. The trust was broken. The tragic legacy of OxyContin left an indelible mark on America, creating a generation grappling with the devastating consequences of addiction, a crisis that continues to this day. By the late 1990s, what began as a promise of pain relief had morphed into a national public health crisis. The scale of opioid addiction was staggering. Behind every statistic, there were real lives shattered, families torn apart, futures derailed, all by a drug once hailed as a medical breakthrough. Despite mounting evidence, Purdue Pharma staunchly defended OxyContin, even introducing a new, tamper-resistant formula that was ultimately too late. the legal floodgates opened. States, counties, and thousands of individuals sought justice against Purdue Pharma, alleging deceptive marketing practices. Victims and their families bravely shared their harrowing stories, testifying to the devastating impact of addiction and the insidious nature of its onset. The financial cost of the opioid crisis escalated dramatically, billions in healthcare, lost productivity, and social services, burdening communities nationwide. Small towns and big cities alike bore the brunt, grappling with rising overdose deaths and the overwhelming demand for addiction treatment resources. Doctors, initially trained to trust pharmaceutical claims, found themselves in an ethical quagmire, caught between patient suffering and the growing evidence of harm. Out of the darkness, patient advocacy groups emerged, giving a voice to the voiceless and demanding accountability from both pharmaceutical companies and regulators. The crisis eventually forced policy changes, leading to stricter prescribing guidelines, prescription drug monitoring programs, and increased funding for treatment. Law enforcement also shifted focus from individual users to targeting illegal drug distribution networks and holding manufacturers accountable. Amidst the legal and policy battles, the focus also turned to expanding access to treatment, embracing harm reduction strategies, and supporting long-term recovery. Ultimately, Purdue Pharma faced bankruptcy and a multi-billion-dollar settlement, a stark reminder of the consequences when corporate greed overrides public safety. The ripple effects of this crisis continue to be felt today, impacting a generation and reshaping how society views pain management and pharmaceutical responsibility. The story of this miracle drug is a cautionary tale, a powerful lesson in critical thinking, ethical responsibility, and the enduring strength of the human spirit. But the dream of calm ease soon began to fray. What started as relief for millions slowly became a silent battle, fought in suburban homes across America. Patients found themselves needing more, taking doses outside prescribed times. The relief was fleeting, replaced by annoying anxiety the moment the effects wore off. Doctors, initially confident, began to notice a troubling pattern. Patients returning sooner, requesting refills, describing a new, unnerving sense of unease without their miracle pill. The whispers of addiction grew louder, no longer just from fringe groups, but from the very patients who had once praised calm ease as their salvation. Withdrawal symptoms emerged: tremors, severe anxiety, seizures. The very conditions calm ease was meant to treat, now amplified by its absence. Researchers, once focused on its benefits, now meticulously documented its dark side. The data painted a grim picture, a new epidemic quietly sweeping the nation. Slowly, the truth began to pierce through the public's perception. Magazine articles, then television news reports, started to expose the hidden crisis. The phrase "mother's little helper," once a pop culture jingle, now carried a bitter irony, symbolizing the silent struggle of countless women trapped by prescription dependence. Journalists dug deeper, interviewing doctors who regretted their early enthusiasm, and patients who bravely shared their stories of recovery and relapse. The Food and Drug Administration, initially approving calm ease with little hesitation, now faced mounting pressure to reevaluate its safety and widespread use. Pharmaceutical companies, initially champions of calm ease, now found themselves on the defensive, citing its proven efficacy while downplaying the growing evidence of dependency. Congressional hearings began. Testimonies from heartbroken families and doctors conflicted with the industry's narrative, creating a tense national debate. For many, calm ease had ceased to be a solution. It had become the problem itself. Families watched helplessly as loved ones spiraled into addiction. A generation promised serenity, instead grappled with dependence, anxiety, and a profound mistrust in the very institutions meant to ensure their well-being. The story of calm ease remains a cautionary tale, a reminder that the promise of a miracle, when unchecked, can pave the road to unexpected and profound suffering.